Okay. So school age children, we generally think those the ages 6 to 12 years old. It starts when they start losing their front teeth, and it goes to the end where we start to see on them going into puberty. Okay, so it begins with the teeth coming out, and it goes to when they're starting puberty. Their height and weight, again, like toddlers and preschoolers, slows down. They're still about 5 pounds a year and like 2 inches a year. But if you can imagine 6 to 12 years old, you do change a lot. So you do double your weight, and your whole height is going to be 1 to 2 feet higher. But at this time, in school age, boys and girls are the same. You don't have boys really taller than girls, and girls really shorter. They're actually equal at this point. As they get older, their movements are more graceful. They're less clumsy as they were. They get to have more muscle tissue, less fat folds all over the place. Again, head circumference is not an issue at all anymore. And they start to get that grown up looking face. The one thing I could tell you about school age, there are some children that look old, and they look older than their age. Remember, if they're 8 years old and look 16, remember, their physical look doesn't match their mentality. So again, if they're 8 years old, their developmental levels that we go to them should be at an 8-year-old. We know their bladder gets better. They're not going to have to urinate as much on a road trip like we would when we were younger children. That heart that took up the chest is smaller. And because of all of the immune bodies, the antibodies formed because all of these viruses and colds and sicknesses that they've gotten, that immune system is really good. And the bones are getting stronger, and they crack easier, right? Remember, when they're younger, they're softer and more pliable. So prepubescent is that ages 2 years before they go into puberty. So when we think about that, prepubescence is ages about 9 to 12. And boys are later than girls. So girls tend to mature before boys. That's why boys are like silly and dumb when you're in fifth grade, right? Like, oh, they're stupid. They don't know what's going on. But they're not through puberty yet, so they're not maturing as well. So puberty is 10 in girls and 12 in boys generally. Now, when we're explaining anything to a child, of course, we're always teaching them what stuff's going on, what examinations, what tests, et cetera, is going to be done. Remember to get on their developmental level. For instance, when you have a 6-year-old and you say, oh, we're just going to do an x-ray. Now, this little boy might think it's x-ray vision, it's going to send gamma rays and it's going to burn up your body because they don't understand what an x-ray is. But if we say, I'm going to get a big camera and it's going to make loud noises, it's going to be hanging from the ceiling, but I can see the inside of your body. Now, that sounds exciting. And I always show my children their x-ray so that they're not afraid of it. It could be a broken bone, or it could be their lungs and pneumonia, and I could show it to them. And that actually helps them understand about their illnesses. We do inspect, auscultate, percuss, and palpate the areas. Lymph nodes, like the cahoots told you last week, they're non-palpable unless they're sick. Healthy has nothing there. Another part of the assessment is doing that hypoglossal nerve. It's basically the tongue, right? So if they can stick their tongue out, they have a good functioning hypoglossal nerve. Even infants, remember, they like to imitate, right? You stick a tongue out at a little baby, like, they're all of a sudden their tongue is going to come a little bit out of their mouth. I've never met an infant that I couldn't get them to do that. And remember, as you're listening to breath sounds, where you apply the stethoscope is what the sound you're going to hear. Are we hearing bronchial sounds? Are we hearing the real lung sound? So if we place a stethoscope over the trachea at the suprasternal notch, which is basically about right here, the suprasternal. This is what actually you'll see the air coming in and out on a kid with bad respiratory and struggling. But if you put your stethoscope there, it's going to be bronchial lung sounds. Now, Freud. This probably is the most tested question on HESIs and CLEXs. They love Freud, and they start talking about and Erickson on the school age. They love these. So Freud talks about, everything is all about sexual things, whether it's oral or anal or phallic. Well, this is all about relationships. Freud says relationships in school age children are same sex pairs. It's boys and boys and girls and girls. It's rarely boys and girls are friends, just because that's what normally do. Now, Erickson. Erickson is profound at this stage. There are school age children that are the best spellers in the world. They are the neatest writers, in their cursive, right? Or they're good at math, or they're good at maybe playing an instrument, or maybe they're the best at playing sports. So what they can do really, really well is what we call their industry, a sense of industry. I do that really, really well, right? But then we go to the sense of inferiority. So it's industry versus inferiority. So industry, I do this really, really well. Inferiority, I can't do everything well. Maybe I'm great at schoolwork, but I'm clumsy in the sports field, right? And that feeling of not being able to be good at the sports also gives them a feeling of inferiority. Children, school age children, want to do everything well. And when they can't, they don't feel good. They feel inferior. So, industry is the tasks they do well. Inferiority is all those things that they can't. Piaget, again, this is starting to get more understanding and more logical. They're understanding relationships between things and ideas. And they're starting to understand, like, masters of conservation. I tell this story at every class. Conservation and school age children. Most parents will shop on the weekend for the week. They not have the ability to shop for a month or whatever. That's just normal what people do. So every Friday I'd go out and I'd buy my children both a box of Little Debbie's for their snack when they got home from school until they waited for dinner, right? Well, they knew if they ate them all in one day, there's going to be no more. So they learned to conserve. Actually, my son learned to hide them all over the place so my daughter couldn't find them. And when I moved from that house, I found Little Debbie cakes everywhere and the ants that went with them. They also understand those relationships of doesn't matter if the cup is small, big, skinny, tall. If you pour the water from one to the other, it's still the same amount of water. And like clay, if it's a ball of clay and you smush it, it's still the same amount. Or things in different patterns, it's still the same number in each line of the pattern. So these are things, they're starting to be logical. They're getting it. It's not different, it's the same. They're just, in different shapes or forms. Goldberg again, good and bad, right? And a consequence for each. So again, their understanding of that reward and punishment makes them like, what am I going to do? It's something bad, but I really want to do it. And the consequence is okay, I'll take it. Logical, right? They're going to do something because they wanted to get away with something. Maybe it was go have a cookie before they had their dinner because they really wanted that cookie, and it was okay because they're going to eat dinner and go to bed anyway, right? So these are things that they're starting to understand. Kohlberg, again, all has to do with right and wrong and then manipulating it for their way. Their spiritual development still continues. They're getting smarter, they're understanding more. Again, it's what the family believes in. And they really at this point are starting to ask more questions. What is this God? And remember, God is whatever it's called. There's many different names for God. It doesn't mean that God is, the name. It could be you know, Jah will provide, as the Jamaicans go, or it could be the religions of Voodoo or Hinduism, whatever the name of those gods are, it's somebody that gives you that conscience to do right. So at this time here, these children, school age, believe that, yesterday I hit my sister. Today I'm in the emergency room and my appendix busted. It's because I hit my sister. So they believe that they're getting punished from whatever that God's name is, okay? I actually understand this a lot. And when I worked in the emergency room, of course, we had a lot of children come in through with appendix, and that school age children is one of those prime ages for appendix. And I would say, listen, you didn't do anything wrong. This is just a piece of your body that says, I don't want to be here anymore. And we're just going to take it out. And then I also tell them, I'll put an extra stitch in there so your insides don't come out. And you should see these children just relax. Their shoulders come down. Like, oh, okay. So I didn't do anything wrong. I'm not being punished. Peer groups are really, really important. They tend to do what their peers do. You'll have children who want to join soccer, and your peer wants them to join baseball, and they'll not join soccer and go to baseball for their peers. They want that. They want that feeling of belonging. And many of the kids will give up what they want for those things. And then who they are and what they are, again, is the peers really do influence them quite a bit. Clubs and peer groups, this is when you start to have these groups, those Girl Scouts and Boy Scouts and, baseball teams, Little League, etc. This is how children start working together and be able to cooperate as a team. And it's not just a single person. We know there's going to be bullying. Well, I made a cake that tastes better than yours, or I did this project and yours is icky, mine is nice. Bullying, it's going to happen. That's what kids do. They feel like they have to be better than the other person. It's just part of it. The relationship with families is so important. They really need to be involved. They need to be there as they're adults. They don't need to be a friend. They need to be there to keep them, keeping them, gaining their independence away from them, but being involved so that other people don't influence them in the wrong manner. So they're breaking away from the family slowly. They're going to their friend's house. They're doing sleepovers, all of these things away from the house. Again, parents need to be totally involved. Play continues, right? I said all through childhood, play, 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 play. Play has rules and rituals which help them get ready for the work world as they go out there, right? Because you need to do certain things to get your tasks done. And it helps children feel good about themselves, whether they learn how to play a piano, whether they learn how to play baseball and they become the best pitcher ever, whatever it is, it's really good for that personal self-esteem. They're getting aware of what they're good at. They're getting aware of what they look like. They want to have those shoes are the coolest, or the girls are the prettiest bows or headbands, or, they just want, or the glasses have to be really cool looking glasses. These are really, really important because they're self-awareness. Remember, all adults that touch that child's life can positively or negatively affect them because they do look up to adults for that praise, okay? So giving them praise is really important. Being aware that the adult sees these changes, or, wow, you got new shoes, those are pretty cool, really, really does help this with this body image. They do like themselves as younger kids, but we know as they get older, they're not going to like themselves for many different reasons. Adolescents have an issue with body esteem, body image. They feel they're too fat, too skinny, too many pimples. The hair's too short, they're too long, the color, whatever. But school age, when they're younger, they just know that they have a cute outfit on. As they get older, they're going to be more into, I don't like this and that about me. They're going to, really be hard on themselves. They're aware that all children are different. They're going to be aware of children that wear glasses, have braces on, or hearing aids, freckles, curly hair, short hair, fat, skinny. They're going to be aware now that children are all different, adults are all different. So when we enter school age, we know at age 6, it could be starting of kindergarten or first grade, depending of their birthday, of course, and we've gone from preschool, which is more fun and nap time and, more playing and drawing and coloring, get into kindergarten. Now it's going to be stricter. It's going to be that they have longer time at school. And again, this is now that place where they're learning to socialize. Other values are coming in. Other kids are teaching those things. And of course, teachers themselves are teaching them different things. At this time, into school age, it's nice for them to have peers, nice, good peer relationships, because they can talk about those differences. Telling somebody about it who's there with them is really good. So they're getting away from the home, more time spent out, more influences are coming in. Nutrition, nutrition, nutrition. Again, all for your lifetime. It's very, very important. We know that children, school age children, are very teachable. This is a great place to teach them about nutrition. That My Plate is a site on the internet, and it helps them pick out food choices. Now, it is hard to do food choices when a lot of those foods are expensive, especially in those parents who are just trying to get food on the table, and they can't be worried about how much fruit or vegetables, fresh stuff are there, because they can barely afford what they're doing. So, but it's good to start teaching them about those choices. We also know that school age children, they have homework to go down, come home to, and they have to take their bath, and they have to read a book and get to school, and it's so busy, and both parents are working, or single parents, they're working. There's a lot of fast food, and that could make children again get to the point where you'll see more obesity. School age children used to get up, come home from school, change into their play clothes, go outside and play. You didn't have TV with channels that worked all the time with cartoons. I remember that. It was only on Saturday mornings or early in the morning I watched Little Rascals. That was it. There was nothing there. Today we have computers, video games, telephones, and they come in and they just want to play their electronic devices, as I call it. So there is a lack of physical activity because of this technology. Overweight children, these are school age children, ages 6 to 12, have an increased risk of hypertension, diabetes, and high cholesterol because of these cardiometabolic changes in their body from being overweight as school age children. So what do we need to do? As healthcare professionals, it's that education, especially school nurses. I think school nurse is a great profession to do. If I would go back, I probably would do it so that I'd have all the days off with my kids, as they got older. But I didn't. I'm an ICU junkie, but it's okay. So early education about the effects of diabetes can help prevent obesity. There's a lot of programs that school age children get. I remember my children had Dare to Keep Off Drugs, and it tells them about the dangers. And then we have this about obesity. So they do listen to this stuff. So how to prevent obesity? Well, it starts with pregnancy, and then of course watching that growth and development. That's why we do weights every visit. Are they gaining too much weight? Are they getting fed too much too early? We know that all ethnic groups are treated the same. It doesn't matter your ethnicity. The childhood obesity is in all of the areas. There's not one targeted. And school age children, many a times, they will be told you can't get off the dinner table until you eat all your food. So they're starting with this, you must finish your plate all the time. And this actually leads to obesity. Children should eat till they're full. And if they're not hungry, fine. Of course, then no snack, no dessert. Sleep and rest, they're sleeping less than they did as infants. They have a lot of demands now. So they are getting to bed later. Now, early in childhood, in school age childhood, it's harder to get the kids to school. There's always going to be complaints. I want another kiss, Mom. I want another hug. Can we read a book? I need a glass of water. I need to go to the bathroom. I mean, all of these things. And you hear it repeatedly. But as they get older, you say it's bedtime, they go, and you're not going to hear complaints because they know it's not going to get them anywhere. They're still going to go to bed. Sports is good, but remember, there is a lot of issues with physical and emotional maturity. Learning how to play, understanding losing, understanding how to warm up to play so there's not a lot of getting hurt. And remember, not all kids are good at sports. And maybe they're good when they're 9 years old, but at 6 years old, they may not have been. So giving the child a chance to catch up to the other kids sometimes. You know, kids love competition. You know, my grandson wants to win all the time, whether it's on a video game, whether it's on, you know, a board game, cards, whatever. I want to win. Why are you doing that? You can't win. That's mine. No. So school age children do want to win. So their teeth have come up. The baby teeth come out, and now permanent teeth are coming in. Now that they should minimum, they should be brushing their teeth. Now we're saying, yeah, they all should floss, but kids that are in first grade do not have that manual dexterity yet. So oral hygiene through brushing with a brush is what they should be doing, especially before they get to bed. Now, what happens in school age? It happened to me. I cracked my tooth, front tooth in half. My brother pushed me down on a cement floor. I had 6 brothers, and it cracked, okay? Sometimes the whole tooth comes out from the root, and I can't tell you how many parents bring it in a baggie or bring it in a little jar, but when this happens, especially on a permanent tooth, you don't want to have to put a post in, you know, spend the money to get a real tooth put in, especially the front upper teeth. If you take that tooth, root and all, and put it in cool milk, cold milk, get to a pediatric dentist or to a pediatric emergency room, a pediatric physician can push it back in, and it will take a lot of the time. They'll numb it first, of course, really good. Then they'll push it in place. Then they'll be on a soft diet, follow up with a dentist, and they actually do pretty good. So put it in cool milk. I didn't know that until I was working in the emergency room. They're starting to get more and more curious about sex. And probably they've walked in a mom and dad, they don't understand, or they hear noises, all of these things. You know, school ages, you know, want to know everything about everything. So at this point, they do need some formal sex education. And it should come from the parents. But what if the parents, my parents, don't talk about this stuff? Never did. The day I got married, they asked me if I thought about birth control. And I'm like thinking, Mom, I've been having sex for 5 years. Yes, I have thought about birth control, Mom. But if you can't, where can you go? How about a school nurse? School nurses can be there to give that information. They're still too young to go to Planned Parenthood or that stuff. That's its adolescence. But school age children to learn about sex and all about, you know, the process of reproduction, the school nurse is a good second choice. So the nurse's role, right? We're going to have questions all the time. Where do babies come from? You know, and they really don't understand what sex is, sexuality, you know, and explaining it. First, find out what they're talking about. They may not have any idea, and you're just explaining too much. So ask them questions first to know how much they know. And again, there should be open communication. I know my kids were taught everything early on so they'd understand. And my children used to say, Mom, stop. I don't want to hear this. but I'm going to talk to you anyway. So, the school health nurse. So, you have a nurse at school. What are they responsible for? I think about when COVID happened and schools were shut down. Who was the frontline person at these schools that had to know what to do? It was a school nurse, right? Because all these questions are coming in. So, keeping records of those things. Other ways I've seen school nurses involved, I've seen it through children who come in and who have bacterial meningitis. We alert the school. We have a child positive for bacterial meningitis. They need to send out little handouts to those children, the children's parents who had some contact or maybe had contact with that child. And they need to take a prophylactic antibiotic. That's the way that's treated. What about if all of a sudden you have a breakout of, swine flu or one of those? This is the school nurse sending out information, giving education on getting those referrals out. Again, injuries are the biggest thing. Any age children, unintentional injuries happen. Now, again, motor vehicles will always be number one, whether they're, in the car with an accident, not strapped in properly, ran over, back over, these things happen. So it is said they should be in the rear seat till they're 13. And I remember young kids, mine, I had gone through a divorce at ages, they were 9 and 11, and they used to call shotgun. They wanted to sit in the front seat with me. Well, little did I know that they shouldn't have been in the front seat yet. When they're on bicycles today, they need helmets to protect their heads, and it does work. I've seen children not use helmets come in and do have some sort of brain bleeds going on, from a bicycle accident. A couple of years back, they came out with those scooter boards where you just pushed it and it, just moved them around, and it was the coolest thing. Well, the one thing about them, yeah, they're cool. But I have had that Christmas when it came out, I had two boys come in with bilateral fractured radial and ulnars because they put their hands down as they fell off the scooter. They didn't have any wrist restraints on them. So they can be dangerous. They really need to be really closely supervised. Trampolines, let me tell you, injuries like crazy. I wouldn't put one up in my yard. The kids begged for it, and I was always afraid there's legs going through and broken legs. And what about other children in the neighborhood using it? So they really are not recommended. So again, parents and families, you've got a child who's been in your home that you've nurtured and you've hugged and you've kept them safe. Well, now they're starting to get away from you. And they need to get this independence because they need to get to the point where they can go off to college or they need to move out of the house and start living their own lives. So they parents need to allow this independence, but be unobtrusively as possible, watching them closely to keep them really, really safe. Some things that can happen with children is that child with ADHD. This is a child who attention deficit hyperactivity disorder. They cannot sit in one place for long time at all. Also, they go from task to task to task to task. Now, usually these children will get to the point where the teacher will send them to the school nurse. Now, many of these children, parents have seen what's going on at home. They have taken away all privileges. They've tried to go to counseling. They've tried so many things. After we see, as a school nurse, we start seeing those children coming back and they're still not getting better, we need to call that parent in and we need a parent conference to see. Do not ever assume that parents have done nothing. First of all, listen to what they've done. Listen to the parents. I'm sure they're frustrated, totally frustrated. And if you're just going to sit there and point a finger, you're not helping anybody. So first, listen to the parents. And they probably need a hug because, having a child with ADHD, not being able to get things done is extremely frustrating. So a child has an avulsed knocked out tooth. The parents are reluctant to try to reimplant the tooth. Where should the tooth be placed for transport?
Okay. And milk. Put it in milk.
In cold milk. Absolutely. Good job. All right, adolescence. This is the roller coaster ride. I think as a single parent, I didn't get with my husband until my daughter was 17. My son is older. And adolescence as a single parent, it was like, let me hold on. This roller coaster ride is going to get hard. These children go from being children to wanting to be an adult. They go from looking like children and they have this rapid physical, cognitive, social, emotional maturation, and it happens quick. They adolescents, they say it's when the appearance of sex characteristics, puberty, and then it will go up to cessation of body growth till about ages of 20. I sent my son away to the army. He was 19. He weighed 147 pounds. He was 5'10". Came back 2 years later, so 21. He was 200 pounds and 6'4". And so when they grow, it's all different for all children. So primary sex characteristics is what we use to have babies. And the secondary are those things that happen. It's that the voice, all of a sudden, they're all the same when they're young. Boys or girls, they have these nice, higher tone voice. And all of a sudden, the voice gets really deep. And you're like, oh my goodness, is this Mikey? Where did my Mikey go to? And all of a sudden they're getting hair on their chins and hair in other places that I don't want to even know about. Girls getting breasts and getting those curves. It's like, okay. Now, in boys, the first pubescent change is that their testicles get enlarged and thin. That's boys. And girls, the first pubescent change is all of a sudden you have little breast buds. When you see this, I mean, is not necessarily going to see the boy, but the girl, you can see those little buds coming. Puberty is right around the corner. So when you're trying to figure out when this is going to happen, Tanner stages are important to look at. Boys and girls, and what is it going to look like? So this is stages 1, 2, 3, 4, 5, and 5 is an adult, and number 1 is, where we just start. Physical growth. Now, in the beginning of adolescence, you are going to have this, what we call an adolescent growth spurt. It's 20 to 25% of your total height. Again, I'll use my son. In 8th grade, he was 5 foot nothing. And all of a sudden, he went into 9th grade. No, it was 9th grade to 10th grade. And in 10th grade, all of a sudden, he was 5'10". It was like, poof, he went really, really high. During that age, remember, they're eating. They're, going through all of these changes. Their voice changes, and they need really good nutrition at this time. There's many, we're going to have issues with scoliosis, which you're going to talk about in another lecture. But this 20 to 25% growth spurt, they really need good rest. They're growing just like infants, right? What do infants need? Nutrition and rest. So do these children, but they don't always get it because adolescents are busy. They're trying to get ready for school and they have their friends to go out to and all of these social things that they want to do. Now, Erickson, important one. It's a sense of identity, as in, who am I? It's also about that body image. I'm too fat, I'm too skinny, I'm too short, I'm too tall, I'm too whatever. I mean, no adolescent is happy with themselves. I mean, rarely an adolescent is happy with themselves. It's also knowing, who am I? Do I like girls? Do I like boys? Do I like them both? Or I like nobody? Emotionally, you get to be understanding, who you are. What's your sense? The goal is actually to independently be able to be by themselves, but they still need the parents, and they don't want that. They want to be able to say, yeah, I can go with you Friday night to the movies, and mommy can't tell you no. They just want to be able to do that. And here, I need $20 to go, mom. They trying to not have parents tell them what to do. It's also one of these intense sociability, intense loneliness. And what is that? Well, there are times where your best friend and your peers, and you've got a boyfriend or a girlfriend, whatever you have, and you're happy and everything's good. And then all of a sudden, your best friend, you find them kissing the boy that you liked. Now you have no best friend, no boyfriend, no girlfriend, and now it's intense loneliness. And this is what goes on in adolescence. There's many different ways to explain it, but I think that's a good one. They want to be accepted by their buddies in them, as I called my kids, by their peers. They want them to say, wow, you dress cool. Wow, you really look cute. Body image, so important. Acceptance by peers. And they'll find their peer groups, whether it is the goth and wearing black and, rock music, or is it music in the band, or is it in the glee club or whatever, or the smart kids sports clubs, acceptance by those groups. Relationships with parents, as I said, is going to change. They needed the protection initially, but now they're going to fight against it. There is a lot of, fighting going on as teenagers. They want all the privileges with no responsibilities. I mean, I used to say to my children and teenagers, you do good in school, you do your chores at home, you can have your privileges as long as, it's an agreeable thing. And there are some children who just, don't do good in school, or don't get that best grade they could, or they didn't do their chores, they didn't take the garbage out, they didn't do the dishes, they make their bed, whatever it is as your things. And they still want to go out on the weekends and do what they want without putting any of that responsibility towards the house. So in the ages of between 15 and 17, we call it conflicts over independence and control over responsibilities and the relationship with their parents. It's independence and control. They want to be independent with no control. They want to do what they want. Now, at this age, it is said that these children, ages 15 to 17, going through these struggles, should sit down with the parents and make an agreeable plan. What works for both of them and come to agreement. It's something that can help setting those limits and structures for those children. So as I said, relationships with peers, very, very important. Again, that peer group is that feeling of strength, power, belonging, and you feel really good about that, okay? And it helps you break away from the dependence of the family. Now you have a group of people who are supporting you like their family, right? They also say best friends are usually same sex, not necessarily. But what I thought was really interesting is best friends, the way you treat them in the adolescence, will be the way that you're going to treat your partner for life. So if you're really good to your best friend and a lot of caring there, that's the way you're going to be with your relationships for life. Now, talking with adolescents as a nurse. Again, like getting on their developmental level, we build a rapport first with these adolescents. If they come in with an earpiece in and you hear music, what sort of music do you listen to? And I think you're let me listen, just to start up. I'm like, oh, who's that? Oh, I never heard of them. Okay, so I'm breaking something open. I'm like, well, do you like music? What are you going to go to college? Or I'm going to say, oh, those are the newest sneakers out. I said, where did you find them? My kid wants them. Something now I'm breaking that ice. Another thing, you have a girl who comes in, let's say, and you see them dressed very male. You have a baseball hat and the way that their clothes and their jeans, etc. are. You know, one thing I have learned, I'm going to ask, how do you want me to address you? For instance, I have a stepdaughter. Her name is Rachel, right? But she wants to be called Ray. And out of respect, she's called Ray. And because of that respect, our relationship is awesome. So it is asking our patients that. And again, they will open right up to you when you're accepting like that. One of the things about adolescents, and especially if you're working with a subject like, let's say you have a girl, frequent urinary tract infections comes in, and you have a feeling maybe it's due to sexual activity, which could be, take the parents out of the room, close the door, and talk with them openly and honestly. You do not have to tell the parents what has been said in there, as long as it's behavior that's not going to hurt them or others. Because we can say, all right, you have urinary tract infections. You know, it has been said that if you urinate directly after sexual intercourse, it can help decrease urinary tract infections. Or you can go take a shower and clean yourself. That can help. You know, you can teach them something. Another thing is, again, as you're just that one person one time, let's say in a hospital, but if you need to give them another resource, there we are, the school nurse. You know, again, could be that person to help. The one immunization they get is the HPV vaccine. It is boys and girls get it, and it is prevents cervical cancers, um, and it is something that they get when they are, you know, right at the beginning of adolescence. Nutrition, these kids are taking a bar of whatever, you know, and a bottle of water running out of the house, and they're so busy they're not eating correctly. So if we're having a problem with nutrition, whether too much, too little, again, having a 24-hour diary of those foods, we can find out what are they eating, or maybe they're just eating all at nighttime, which could be causing why the weight is gaining on these children. Or maybe they're not eating when they get home, so this is why they're, you know, not enough nutrition. Sleep and rest. You know, adolescents go through this pre-adolescent growth spurt. They need rest. They don't get it. They actually, if you look at it, they should have as much sleep as infants, but they don't. They are too busy trying to get homework done, talking to their friends, texting to their friends, playing on their electronic devices, you know, and then socially going out and doing the activities that they want to do. So they don't get the amount of sleep that they need. Many of them don't get the exercise they need. And, you know, we, of course, again, dental health. Adolescents can floss, and adolescents can brush their teeth too. I've already talked about sex. Again, it's parents, school nurses, Planned Parenthood. Safety promotion and injury prevention. So now they're getting old enough to drive a car. So now it's not just in the car, sitting in the car, ran over or run onto, and now they're driving and having accidents. So again, it's one of those things that we really need, you know, to teach them how to be careful. Firearms, one of the biggest things that we see is firearms and injuries from that. So unless they are with an adult, they shouldn't be touching any sort of firearms. Sports injuries, you know, are they warming up properly, or are they trying so hard and working so hard they're doing this overwork sort of injuries that can go on? Again, wearing proper equipment, so important. So Matt's 14, he's always eating. His weight is appropriate for his height. So he's always eating. What's why? What's the best explanation for that? Pre-adolescent growth spurt there, isn't it? So it's normal. He's getting bigger. He needs it. You know, he's the fuel, just like an infant. All right, we made it through. Let's go to a cahoots, okay? Who would like to win a cahoots today? Let me pull it up for us. So this one has 48 questions. The one thing about this computer, it tends to be a little slower in loading. Give me a second. Come on. You can do it. It is a day of patience, isn't it? Let me do something. Let me try to stop sharing.
Ready?
Thank you for staying with me. Here we go. 824-1149. And let's get started. Soon to be nurse. Absolutely. School age and adolescent children, week 3. How does the onset of pubertal growth spurt compare in girls and boys? Remember, I told you girls think that boys are stupid at one age, about 5th grade, 6th grade. And it does. It occurs in girls about 2 years before boys, usually 10 in girls, 12 in boys. At what age should a parent expect to have major conflicts over independence and control with their child? What ages did I say that's when you need to make a contract? Because they want to do what they want to do, and parents still need to be in control. That responsibility and privilege thing. And it's 15 to 17 years old. Signs of the onset of puberty in girls. What's the first thing you see with girls? So in girls, the first thing you see is little breast buds, right? And then we can look at Tanner stages to see where we are and how soon we can expect it. The onset of puberty in boys is characterized by and boys, it is testicular enlargement. That's number one. Yeah, they go through that voice change and hair, et cetera, et cetera. But the first thing is the testicles get large and they get thinner. What do we use to determine if a female has reached the age of menarche? So if we look at what's happening, to a girl, those changes that are there, when do we know that this is all going to happen? And what do we use? I just said it and I showed it to you. And it is Tanner stages. Remember, 5 is the adult and 1 is the beginning of menarche. The source of injury, whether intentional or unintentional in adolescence, is associated with what? Again, I said this is something that is all age children, from infants onward. And it is motor vehicle accidents, okay? Motor vehicles, you're going to see it all the time. This is those areas where children are hurt. If a parent feels uncomfortable talking about sex education, who's a good resource? And that's the school nurse. The school nurse has a big responsibility, to the children in answering those questions. A 9-year-old friend tells him soccer's a dumb game and he should play baseball. Is that something that will happen? Should he play baseball or soccer? Remember, school age children, especially at this age in school age, peers are extremely important. So peer acceptance is important, and they will change from soccer to baseball just to be around the peers or his best friends. During admission, the father of his 16-year-old says, "We are Buddhists. Culturally competent care includes." So we need to ask if there are any preferences in care. But, not only asking the father, this child is 16 years old. That child can tell you what they want from, the care regarding Buddhist. Is it because they're vegetarian or they don't eat this or they need time to pray? What do they need? I don't know. I'm going to ask that parent. I'm going to ask that child. When teaching sex education and contraceptive for adolescents, what should the nurse consider? Should be in oral and written form, something they can go back and they can look at and read so that they do understand. And so having those handouts are very important for these children. Sexual activity, contraceptive, yeah, they should have planning. They're not always. So the best thing is if they're asking you information, it is to have that information. Talk to them and give them the handouts that they need, oral and written. A multi-select. The management of adolescent obesity should include what? Again, this could be a child who was school age, who again was overweight, became an adolescent who's now overweight, and we know that adolescents don't eat properly. They get a Nutri-Grain bar and a bottle of water and out the door. But let's do that 24-hour diary of food, find out what's going on. And the other thing is, you don't have to take away everything. Give them that one treat, maybe once a week, incorporating some of their favorite foods in there. Diversional stuff, that's not going to help an adolescent. That's for younger children. And do adolescents really want nutritious food as a reward? No, they want what they want to eat. So incorporating the favorite foods. Infants go through a predictable sequence of growth and development. This is called. I will now and then pull you back to a question from a previous week. Sequential trends. Things happen in sequences. They lift their head up, they roll over, they crawl, they creep, they walk. This is all very predictable. Sequence. Which benchmark serves as the ending period for school-age children? Begins with the shedding of their baby teeth and ends with onset of puberty. This is where they're going to start with those breast buds and they're going to start with, testicular enlargement. This is what we say the ending of school age, beginning of adolescence. Which action would improve dental health in the school age children? And remember, age of the school age child is very important. I should say most school age children. So they should floss. But remember, younger children, ages 6 and 7, they don't have that dexterity to floss. So brushing the teeth is important. So always, if there's a question like this, look at the question. What is it asking? Just don't assume it's flossing. Yes, it's the best, but are they old enough to do that by themselves? Generally, the earliest age at which puberty begins is, according to the book, and it's 10 girls, 12 boys. Yes, good job. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Why is she saying that? You remember the boy who has an appendix that needs surgery, and he hit his sister. Same sort of concept. It's an absolute common belief at this age. Things that happen bad is because God is punishing them for some bad behavior. Common belief in school children. A 6-year-old needs to get a chest x-ray. What explanation is best? So it's just take a picture with a camera. Remember, they think x-ray, they think it's going to go and it's going to burn holes in them. I mean, some kids, they've got great imaginations, right? So like a camera, we look inside, they're not going to be as frightened. How do you get an adolescent to open up about their sexual history? If you look at this, each stage of children that we've looked at, from infants to toddlers to preschoolers to school age, number one, the first thing we need to do is get on their level and talk to them. I mean, first, no touch, minimal touch, finding out. And, adolescents you can talk to. So, yeah, tell me about what's going on. What do you like to do for fun? Do you like going to movies? Do you like, playing sports? Something, and we'll break open the ice. Oh, you're listening to music. What type of music? How can you get an adolescent to be more receptive to talking about their health and sexual exploration? So get the parents out of the room. Let the child be with you and let the child know that they are safe, okay? And they will open up. And then you can help them, prevent them from getting that urinary tract infection, or help prevent them from getting that, sexually transmitted disease again. Whatever it is, we can do something to help them on that level without the parents in the room. A multi-select. When educating adolescents about the risk for HIV and hepatitis, what would you include? I mean, the best way of preventing it, of course, is abstinence, condoms for sure, and always hand washing. And I really hope they're taking more than weekly showers. I think that would be better, a daily shower. A child has a knocked out tooth. Where should the tooth be placed for transport to the dentist? I don't think you'll ever forget this one. I've had the question, why do we put it in cold milk? I think it has something to do with the calcium in the milk that helps the tooth keep that root preserved, I believe. But I'm really not totally sure about it. But that's what it is. I think it's more of an isotonic mixture for the tooth. And then the root is still good and healthy when it gets to the doctor. A nurse planning care for a school-age child should know about which thought process is seen. School-age children, how do they think? I mean, this question is all about my little Debbie's cakes. So it's not animism. Magical thinking is younger. Those are your preschoolers. Thoughts are all powerful. They're not there yet. What they are believing is they know how to conserve, whether it's you have this many uniforms, it has to last a week, or you have to do laundry, or this is the amount of little Debbie's cake, and I need to have one, for the end of the week. Whatever it is, they know how to conserve. Which stage of Erickson would you use for this school age child? Again, Erickson in school age talks about stuff they do well and stuff they can't. So it's industry versus inferiority. And industry is what they do well. Inferiority are those things that they cannot master that task. But industry is that task they can master and do well. A multi-select. Anorexia nervosa is characterized by, I don't go a lot into these, but I wanted to mention them. There's two. There's anorexia nervosa and bulimia. And they both sound like they're alike, but they're not. Anorexia nervosa, again, is a child who is extremely thin. I mean, radically thin. So they're fear of gaining weight. They don't think they're skinny and they have bones sticking out, so unrealistic body image and severe calorie restriction. Now, conversely, bulimia is when you eat, and throw it all up. Now, how would you know which one was which? Number one, that child who is bulimic and vomiting is throwing up gastric juices too, right? Teeth could be rotten. And that would probably be the only thing you might be able to see in a child anorexic or bulimic, okay? Because the bulimic still is getting rid of those calories, but the teeth is what you're going to see the difference in. In anorexia, they're not eating, so their teeth aren't getting damaged at all. How do you know if you suffer from bulimia? So that is that binge eating and purging. They don't starve, they eat like massive quantities of food. Adolescents are. It's stuck somewhere between being a kid and being an adult. Sometimes they just want to be a kid. They don't want the responsibilities. That's what that is. And they're totally confused, troubled, and frustrated. All that body image and trying to fit in and then figuring out what they want to be and all these pressures from school and parents and peers, all of these things cause that frustration that they're going through and being confused. What is an adolescent's heart rate? We know infants, right? 140 to 160. What do you think maybe here is an adolescent. So when you look at an adolescent, it's almost an adult, right? But they're a little bit more active. So it's 55 to 90, not 60 to 100 like an adult. But that would be an absolute normal one. If they're extremely athletic, of course, we know that that lower heart rate could be lower, but that's basically the guideline for adolescents. When talking with an adolescent regarding personal health concerns, which is most important? You know, one of the things I know adolescents, sometimes they like to tell you things to shock you, you know, and some things that they do can shock you. Trying not to look shocked and like, what? Is a very important thing. It's hard to keep that face sometimes, but let them have that opportunity to really tell what's going on, because the only other person they talk about, maybe not, is maybe their peers, their best friends. So to have somebody else to talk to and ask questions to, if they'll do that to you as a nurse, can help them. You know, sometimes it could be about the way they feel about themselves. And, you know, depression is huge in adolescence due to body image. So letting them talk to you about it can prevent some bad things from happening to that child. A parent says their infant puts everything in their mouth based on Freud's theory. You would respond, what? What did I tell you about children in the mouth? That's Freud. I mean, Piaget is sensorial motor, right? Which is part of, they explore the world through their mouth. That's part of what infants do. Good. As I said, I'll throw some questions from another week in here to try to keep you there. In addition to injuries, a leading cause of death in adolescents ages 15 to 19 are you know, adolescents are out there and sometimes they don't realize what they're doing, and bad things can happen. They could have a gun, it could go off, they can, you know, hurt somebody, or they get into gangs, and, you know, those things could happen, or these fights. And of course, suicide due to that body image and due to those depressions that can occur. That is your answer. In school age, conflict of industry versus inferiority. What does industry mean? That is mastering a task. Good job. Yes, I can play softball really good. Which age group prefers to be with the members of their own sex? Same sex peers. And that is your school age. But the younger ones are not as much, you know, the 6-year-old, but as you get a little bit older, same sex peers, they tend to relate them better than having, you know, a girl and a boy. They want two boys, you know, peers, or two girls peers. Home support is invaluable to an adolescent. True or false? Do they need it? And that's one of those questions, like, they don't want it, right? But what happens if something bad happens when they're out in the environment? They come home. They want mommy or daddy to hug them. They want them to be there for them. So that support is really important. And sometimes that home support, whether they want it or not, can help prevent them from getting in bad situations. So it is still needed. They don't want it. But when they need it, it is there. Contraindication to administering the varicella vaccine to an adolescent. Remember, varicella is a live vaccine. We've talked about this. The live vaccines, immunosuppressed, can't take it. And if you are on steroids, you are immunosuppressed. So if you are on corticosteroids, prednisones, any of them, you cannot take a live vaccine. That's a great med-surg question too. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? Does not indicate that they have anorexia nervosa. They have something else called bulimia. And that's their teeth, because remember, gastric juices do rot their teeth. That's the difference, especially if they've been bulimic for a while. The risk of depression in transgender children is, we're hearing more and more about this due to those shows on, the Learning Channel that there's out there now. The boy who wants to be a girl, and she's a very pretty girl actually. But depression is huge. They are so mocked by, sometimes even the parents don't accept it, and then family members, and then children at school, and it is a big risk for depression and suicides. A 14-year-old in the emergency room after a biking accident. How should the nurse interact with this adolescent? As I said, I was a big trauma nurse, always primary, and I would get these kids in. What is my job there as a nurse for that child? You're coordinating everything. But you know something? If that kid doesn't know what's going on, they're going to flip out. They're going to try to jump out of bed. They're going to be nervous, excited. Heart rate's going to go up. They're bleeding. They're going to be bleeding more. So clear explanations. This is what's going on. This is what's going to happen. They ask a question, answer it. Keep them calm. Keep them relaxed as you're coordinating everything around you. And that kid's going to get a better outcome because of that. Cooperative play. I think you're going to learn all about the types of play after these 3 weeks. Remember, cooperative play is they work together and there's a common goal to reach, as in somebody will win the game, like playing checkers. What does moral development involve? Morality. So morality, again, is right and wrong, okay, and the consequences. And we know who says that. It is Colesberg. But moral development, right and wrong, and the consequence for either of them. Good. Developmental milestones are important to observe because this is even one of your questions on your quiz. So again, asked in a different way, right? These are clues. If they're not meeting milestones, in a decent amount of time, we can get early intervention and we can help prevent it from getting worse, and we can catch these children up easily. Most children get caught up very quick. Lymph nodes in children with normal findings. And we know you shouldn't be able to feel them at all. Good. The right second intercostal space landmark of the heart is called. Knowing these, where you can hear these things in your heart, are important for you to go back and to look at. And that is your aortic valve, okay? Which nerve controls critical movement of the tongue? Again, this is all part of your examination on children, and it's easy. You stick your tongue out, they're going to do it for you. So it's cranial nerve 9, your glossopharyngeal, hypoglossal, whatever. Either name is used interchangeably. What type of breath sounds do you expect to hear over the trachea? Over the trachea. And that is bronchial sounds. You know, it's tracheal. No, you're going to hear the bronchus and what that sound's making. You know, and then different ones are. Is it the breath sounds I'm listening? Is it the lungs I'm listening to, or is it those tubes that connect to the lungs? You know, the bronchus. Depriving a child of food, clothing, and shelter is called what? And it's called neglect. And it could be as simple as there was a story that came out where children were playing in the front yard, playing a ball, and the ball went out in the street, and they almost got hit by a car, and the cops came, and it was 30 degrees outside, and both children did not have a coat on. Because they didn't have a coat on, they had to be reported because that was considered neglect because they should have had a coat on. Basic 30 degrees, you should have a coat on playing outside. They can get really particular with some of these. Which of the following immunizations is given in the adolescent stage? And that's your HPV, okay? HPV, human papillomavirus, that is given in the adolescent. ADHD most likely involves which of the following? You know, these children, they can't sit, they don't pay attention, their attention span's very short, you know, and they're just in constant motion. Again, remember, if we are going to be speaking to these parents, first let them vent about what's going on with their child. Don't ever, you know, come to the wrong conclusion about what's happening. And last question. Adolescents typically place blank on peer relationships. And that's an absolute high value. Good job. Let's see how we did today. Number 3, CJ. This is my grandson's initials. Number 2, Ashley G. Number sounds like a singer. And Mo, number 1. 4? CC and Sammy J. Good job, guys. I want you to sign your attendance attestations. Make sure you get them done. Remember, we're going to be having the first review tomorrow. I will have it recorded and I will get it posted up as soon as I can so that you have it. If you want to meet me for a one-to-one or a couple of you together for, special, get together review of the exam, I'm more than willing. Send me a message. We can get that done because my job is I want everybody to pass. That's my goal. Everybody's going to succeed. All you have to do is ask and we'll get you there, okay? Have a great day. Thanks for being so patient. I'm going to try to get it fixed because I teach again tonight. So thank you so much, guys. Have a great evening.
You too. Thank you for
Good
everything.
luck with your community exams.
Hi, Professor.
Yep.
Could you
Thank
wait?
you.